Hello, my name is Manuel Izquierdo. I am a pulmonologist with Prisma Health. Today we're going to be talking about cystic fibrosis. What is cystic fibrosis and how is it usually found? Cystic fibrosis is the most common autosomal recessive disorder that is lethal, affecting Caucasians. It affects approximately 32,000 patients in the US, and here in South Carolina, it affects approximately 500 people. It is a mutation of a protein called the CFTR protein. This protein is responsible for secreting and transport of bicarbonate and chloride. When there's decreased amounts of these anions, there's going to be thickened secretions and difficulty with breathing and clearing mucus. Cystic fibrosis is most often detected in the newborn screen. Can cystic fibrosis go undetected until adulthood? The simple answer is yes, absolutely it can. Some patients go undetected on the newborn screen, and not until later in life do their chronic symptoms raise red flags, which would cause providers to look for things like cystic fibrosis. Who is at risk for cystic fibrosis? Patients that are at risk of cystic fibrosis have family members who are affected by it. This includes people like mother, father, or even siblings. What are the symptoms of cystic fibrosis? Symptoms of cystic fibrosis include difficulty breathing, chronic productive daily cough, chronic diarrhea, long-term sinus symptoms, or even problems with constipation. These can all be findings consistent with a diagnosis of cystic fibrosis. How is cystic fibrosis treated, and how have these treatments improved over the years? I would say the most life-limiting complication of cystic fibrosis is the bronchiectasis and respiratory failure that ensues. We treat this most commonly with something called pulmonary hygiene. This includes nebulized therapies such as salt water, albuterol, and pulmozyme that help break up the mucus. Additionally, we add on therapies that help manually disimpact the secretions. This is called airway clearance devices. This includes things like vest physiotherapy and even percussive devices. Another treatment that has recently developed is something called modulator therapy. Modulator therapy is a new therapy that allows the body to increase the amount of CFTR protein produced and also helps it function better as well. With these advanced therapies, the life expectancy for patients with cystic fibrosis has improved dramatically.